Hi, everyone. Thanks so much for joining. I think we can go ahead and get started. We might have some more folks trickling in, but we'll start with introductions, so that is okay. Can everyone hear me okay? Okay, great.
Hi, everyone. Welcome to the first Project ECHO for school and school-based health center partners. Our monthly webinars will be on second Thursdays of the month at the same Zoom link. This first session is an introduction to the ECHO Hub and its structured peer consultation model via teleconferencing to reduce burnout. Our speaker is Lauren Haack, an associate professor and attending psychologist with research and clinical interests focused on cultural influences to mental health conceptualization, assessment and treatment, accessible and culturally attuned evidence-based services for traditionally underserved youth and families worldwide, and behavioral health provider experience, training, and consultation. She received her PhD at Marquette University and completed a pre-doctoral internship at UCSF, specializing in evidence-based psychosocial services for youth with ADHD. Since joining the UCSF faculty in 2017, Dr. Haack has been involved in numerous collaborative clinical research projects with an overarching focus on harnessing technology to improve access to and quality of evidence-based mental health care for diverse youth and families. Within the UCSF Department of Psychiatry, she leads the Child and Adolescent Psychiatry Field Seminar focused on forensic psychiatry, inclusive services, and social justice, educational settings, literature exploration, and child development. Dr. Haack also collaborates on several Project ECHO series aimed at increasing clinical capacity for primary care, school, and school-based health center providers, as well as youth involved in the juvenile justice and foster care systems. Welcome, Lauren.
Thank you so much, May. So I'm really excited for us all to kick off our first Project ECHO specifically for school and school-based health center folks. So first, I'd just like to all to get to know each other a little bit. So if everyone could type into the chat your name, your organization, and school or school district, and then also just a little bit how you're feeling today, so we can use this rubber ducky poll. So as May said, my name is Lauren Haack, and I'm here at UCSF and have been collaborating with San Francisco Bay Area schools for 10 years. And I am feeling like a 2 today. I'm really excited that we're kind of on this path together. So please feel free to take a moment to introduce yourselves in the chat. Hi, Mira. Thanks for joining and sharing. Hi, Megan. Julie, I think you just private chatted me your check-in. Hi, Casey. Hi, Ilsa. Good morning, Emma. Hi, Shelly. Hi, Dimitri. All right. Well, we will certainly have more time to get to know each other in our case-based learning that we're going to start today and continue doing. So let's jump into talking a little bit about what is this ECHO model and what are our goals for this cohort. And we'll have some time for questions, and then we're going to get into a brief didactic, and we'll actually start our case-based learning. So Project ECHOs were actually developed for rural Arizona providers to treat hepatitis C, and they've since expanded to a number of different fields and areas. And really the idea of this model is democratizing knowledge, so moving knowledge to people instead of making people travel to specialists. So giving folks who are actually on the ground working with students, youth, patients, getting us all together so we can learn from each other. And so it really is this all teach, all learn model that's really grounded in peer support and learning and building supporting communities. So it's not just building skills, but also building the support network. And we do have some didactic learning, but really where the meat of the ECHO tends to be is in the guided practice and the collaborative case-based learning. So our CAP ECHO that we're doing for school and school-based health center partners is really hoping to deepen knowledge, skills, and confidence in how we can support our students' mental health and well-being. Also specifically looking at how can we differentiate the impacts of trauma and other common mental health conditions, apply actual techniques when our students may be struggling, and then through all this, we hope to reduce burnout, increase peer support, and joy and purpose. So how are we going to do this? We're going to have 6 monthly meetings. So today's our first, and then we'll continue in 2023 throughout the rest of the year through May. And every meeting will have this brief learning session at the beginning for about 15-20 minutes. And we'll also give you tools and handouts to take away. And then really the rest of the time will be spent sharing some concerns that you might be having about particular students or about your setting in general, and getting support from one another. So this is an overview of our topic list. Today, we're going to be talking about what is ECHO, and then also what's a specific peer consultation model that has been shown to reduce burnout. In the new year, we're going to kick it off with Santoy Trotter, who many of you may know, talking about trauma-informed language and approaches. Then we'll hear from Jessica Kieser, a psychologist at UCSF who's really expert in motivational interviewing. Then we'll move on to risk assessments and safety planning, and we'll wrap up with how do we recognize and kind of manage internalizing and externalizing problems when they show up in the school setting. So all of these will be on Zoom. We'll start with brief announcements. We'll have that 15 to 20 minute learning, and then we'll move on to the case-based learning. And we're going to ask each month for someone to volunteer to speak about a concern that they're having and receive support from the rest of the group. And then starting in January, we are going to be offering continuing education CanFit credit. And then we'll always have time for questions and answers. So the second Thursday of every month, 10 to 11, again, starting in January, we'll start to offer that continuing education credit. And each month someone will volunteer. In order to volunteer, it's a pretty low load. Actually, we just ask that you fill out a brief form about the concern that you're bringing to the group. This shouldn't take long, maybe about 5 minutes. And then you'll come to the group and you'll kind of see how this goes today. So we hope that everyone can come as regularly as possible. I know everyone's busy, and it's great if we can kind of have consistency amongst each other to build that support. If you're able to turn your camera on, it can really help with building community with each other. And again, if you are presenting a case or a concern, we're just going to ask that you fill out a brief survey right before. And really, we want this to be an authentic, supportive, non-judgmental space, right? So there are no dumb questions. We're really all here to learn from each other. Here's a look at our ECHO Hub. Many of whom are on the call today, some of whom are actually at a California school meeting, so couldn't be here and will be joining us in January moving forward. And here's a preview of our speakers for the didactics. Any questions? Okay, we have a lot to do today, so I'll just keep on rolling. But at any point, if anyone has questions, feel free to unmute yourself and shout out or put in the chat. Our didactic today is going to be looking at how we can use peer consultation to prevent and reduce our burnout. So we don't have any conflicts of interest to disclose. We did want to acknowledge that this is supported by some federal and state grant funding. And here are our learning objectives for this brief didactic today. But really, I wanted to start with getting everyone's input on the topic. So we're going to do what's called a wait question. This is where I'm going to ask everyone to type their thoughts into the chat, but don't hit send until I say go. And then I'll say go, and we can see everyone's thoughts come at once. So start typing into the chat. When you hear the word burnout, what does that mean to you? What does that bring up for you? How does that look in your setting, in your world? So go ahead and type your thoughts. And when you're ready, hit send. What does burnout mean to you? Go ahead and hit send. Feeling disinterested, moving through the motions without being engaged, anger, frustration, sadness takes over the joy, resilience, determination. Absolutely. Less motivation to learn, less joy, less social. So we're seeing some common themes amongst what burnout means to us. And also these themes really match with how the field defines burnout. So we've been looking at this concept of burnout since the 70s. We've really seen actually an uptake in interest in this topic, I would say, since the pandemic. And the way burnout's defined is emotional exhaustion, which some people brought up, also kind of feeling depersonalized or kind of step back from the patients or the students that we work with, and just feeling like we don't really have the tools we need to do our best work. So when we look into the research about can we predict who may be more or less likely to experience burnout, we don't see a lot of consistency in terms of gender, race, ethnicity, or discipline. And so it seems like this is an equal opportunity condition. What we do see is that the longer someone's in the field, the age and years of experience tend to be negatively related to burnout. But we think that this actually may be due to burned out people leaving the field and changing careers, because on an individual level, if you do nothing about burnout, it can stay the same or actually get worse. And if we look into what can we see consistently in predictions of burnout in terms of our space and our occupational settings, sometimes people say that the slide is validating. Sometimes people say it's frustrating. It's probably a mixture of both, right? So the more work we have, the longer we are working, the more pressured that time is, that all leads to burnout, the less resources we have. Also, this role ambiguity, just not feeling like we're sure we know what we're supposed to be doing. And the one that we have the most control over as a group here is this lack of supervision or consultation. So this is where we're really going to try and focus on building up for each other. And I see a question in the chat that the didactic portion of today is being recorded, and we're going to share it with participants who are here today, as well as there's some participants who will be in the cohort that couldn't make it today. We will not record the case-based consultation. And it's okay if some folks feel like they are just more of an observer of the case consultation, kind of take your participation as you feel comfortable. Is burnout considered shameful? That's a great question. Does anyone have thoughts about that, about if burnout is considered shameful? I would say, what the research shows is that burnout is pretty high prevalence, especially for people who work with youth who are experiencing a lot of struggles. And so although people may feel shameful or embarrassed about burnout, the data doesn't match that. That actually most of us who are working with students in the settings that we see them in are going to experience burnout at some point, at some level. And burnout is pretty concerning, actually. We see that people, when they're burned out, they have more mental and physical health problems, which means they're calling out sick more. They may be leaving the workforce. And we also see poor outcomes for the students and the patients that we work with. So there's been a number of things tried to impact burnout. And really the one that has the most support that we are going to do together is this peer consultation. We do know that this method tends to be the most effective when people are experiencing some level of burnout, when people are volunteering rather than being told to do these interventions, right? Sometimes if people are kind of forced to do a peer consultation, it actually can contribute to more burnout. But if people are choosing to do it, it seems to be more effective. And really, it's important that people feel like when they're in this peer consultation group, they are able to share freely without fear of judgment or retaliation in their jobs. And so we want to make sure that we're upholding that in our space together. So how can peer consultation impact our burnout? We have evidence that it can change sort of these negative or cynical feelings towards the people we work with. It can actually improve our communication and consultation skills. It can make us feel more supported and satisfied, less stressed, less isolated. And actually, we can see improved outcomes with the youth that we work with, which in turn can all reduce our burnout. It's a great question. What is considered a peer? Really, a peer is considered kind of someone in a similar field as you, on a similar level as you. So we try not to have groups where there are like direct supervisors with people that are supervising, but more people who are kind of free to openly share with each other. So a specific peer consultation model that we're going to use in our groups is called the Ekstasis model. And so I'm going to pull up a brief video to kind of demonstrate what this model looks like.
One method of peer consultation is called the Ekstasis model. The Ekstasis model is designed to be reflective, learner-centric, interactive, and emotionally engaged. The Ekstasis model can help generate ideas, bolster support, and may even improve the outcomes of those we work with. How does an Ekstasis consultation work? First, someone from the team presents a case to the rest of the group. This could be something you're stuck on or something that's contributing to burnout. Next, the group asks the presenter fact-based questions. This is not yet time to problem solve. Next, the presenter silently steps back and observes the team conducting diagnostic brainstorming. Finally, the team moves on to brainstorming action steps for solutions. This is when problem solving occurs. In the last step, the presenter joins back in to provide reflections.
So the name Ekstasis is Greek, and it actually means to stand outside of oneself. And this is because this model has a little bit of a unique spin than some peer consultations or other supervision consultation models that you may have done before, where actually most of the lifting comes from the rest of the team brainstorming about the concern that you're bringing, with you just observing and watching and reflecting. It is pretty structured, and that is because we are inherent philosophers, and we usually tend to start jumping towards suggestions before we've even heard and understood a problem. And so this model has deliberate stages that sort of forces us to really think about the problem and all of its layers before jumping to solutions. And because you are stepping back and observing people brainstorming, it prevents yes butting, right? So it really allows you to kind of soak in and hear different thoughts and ideas without interjecting. So we're really interested to hear kind of how the model feels to all of you as we go through it. I don't know if anyone will, like a show of hands or reactions, if anyone's done a model like this before, sounds like this before. Great. It's starting to gain some more steam. It was actually developed in the education world and has gained a lot of steam in the recent years. So here are some testimonials from folks that we've done Ekstasis with in the recent past. So people say they feel really supported, that develops a sense of community, helps people feel less siloed, validated, and the confidential nature really creates the sense of connectedness. So here's the breakdown of this structure. So first, someone's going to briefly present a case. It could be something that is happening with a student or a group of students, or just something kind of wider in your school or organization system. And then all of us as a team are going to ask questions just to gather more information about what's going on. Then the person presenting is going to step back, turn off their camera, mute, and observe the rest of the team kind of brainstorming. First, what do we all hear that's going on with this concern that may be contributing to the concern? And then the final step is trying to think about what are some potential action steps that the person could take. And then we come back for reflections. Okay. Really, I think this model is best learned by just practicing, and which we're going to do today. But any questions before we dive in and give it a try? Here's some references for that didactic. ECHO with school-based folks. We've done it with primary care providers and community providers serving justice and systems involved youth. And we really have found in those experiences that getting input from you all really helps us improve the whole process. So we do have $25 gift cards just to thank you all for doing that survey. So please and thank you in advance for taking the time to do that. You could either follow the QR code on the slide, or also here is the, oops, actually, I'm not sure if that's the right link. Let me make sure I give you the right link. In the chat. And we also can send out this link. We'll send out an email today, kind of with the slides and the video from today, and we can send out the link again. If you know anyone that wants to participate in the future, please feel free to share that information with them. You can also just connect us via email if that's easier. And then for our next meeting in January, I wanted to see if anyone wanted to volunteer to present like Emma did today. Do we have any takers from folks who are on the call today? Maybe Suzanne or Megan.
So what kind of case do you want us? I'm still confused on what kind of case.
Yeah, so it's basically anything that you're getting stuck on, that you're feeling challenged by, that might be creating burnout in you, your staff, your students, your coworkers. So it could be like a particular student issue, like I'm having trouble with this student, this is happening. It could be like a larger student problem. It could be a larger staff or systems problem like Emma shared today. It could also be a personal problem like a work-life balance or burnout question. Honestly, anything that you think your peers who are in the school and school-based health center settings could give you feedback and support on. And we will share the slides in our follow-up email. Yes, thanks, Megan.
I'm willing to give it a go in January, but
Awesome. Thank you, Megan. I really appreciate that. So what we'll do, Megan, in the new year, we'll follow up with a link for that brief kind of form to fill out just about your framing question.
yeah.
And that really just helps us think ahead about some resources and suggestions that we could give. And I really appreciate you volunteering.
Okay.
Any other questions or comments? Okay, well, thank you. It was so nice to get together. I'm honestly so thrilled that we were able to do this today. And I know we have more folks who are joining in January that couldn't come today. So I look forward to seeing you all again in the new year and hope everyone has a really nice holiday and gets some rest and relaxation and fun over the break.
Thanks so much.
Thanks. Yay!